Welcome back. Good to have you with us. This month, October, is Breast Cancer Awareness Month. And joining us today is the lovely and talented Miss Janet Kramer down on the end with Erlanger's Breast Resource Center, and Dr. Roxanne Roberts. She's a diagnostic radiologist who specializes in neuroradiology.
Correct.
Well, I'm glad I got that. I've been stressing over that.
Give him a hand.
They do this on purpose to me all the time. But it is a very important subject to discuss this month. Sometimes I wonder, do we put too much emphasis on just one month? Because there are 12 other months, and cancer can start or be detected anytime, can it?
Correct, and that's what I tell women. We concentrated on we take 1 month, we concentrate on breast cancer awareness and breast health issues.
Yeah. But
you have 11 other months that you can go ahead and schedule that mammogram. It doesn't have to just be the month of October. So.
Yeah, and that's the good thing about it. Okay, what's the latest, Madam Doctor?
Well, I guess there's been a lot of controversy about screening mammography in the last couple of years.
Yeah.
The U.S. Services Preventative Task Force sent out put out their most recent recommendations in 2009. And it's a very polarizing subject amongst physicians. The American College of Radiology, the American Cancer Society, the Society of Breast Imaging still follows the original guidelines of starting yearly mammograms at age 40. And 35 if there's some family history.
And as I understand, a lot of physicians, maybe about 50%, are kind of torn on this issue. Some say yes, some say no.
Yes, that's correct. I mean, I think one of the problems that we're seeing is there's a lot of talk about the experts disagree, and the task force was actually not made up. They're not made up of breast imagers or breast oncologists, and I think those people don't disagree. We still think that you should get your yearly mammogram at age 40, and because mammography is the best screening method that we have. It's not perfect, but since mammography has been introduced in the 1980s, you know, breast cancer mortality has declined 30%.
How do you respond to people if they say, you don't know, or let's wait a few years or whatever, because you've been there, I've been there.
And not only was there some discrepancy on what to do with mammography, but also breast self-exam. And I was in a situation where there's only about 10 to 12% of breast cancers that don't show up on a mammogram or an ultrasound. And I happen to be in that small 10 to 12%. So in my case, when a task force comes out and says it makes absolutely no difference whether you have a woman do breast self-exam or not, I kind of hit the roof. Because had I not done breast self-exam, what would have happened, because it did not show up on a mammogram. Even after we knew I had breast cancer, we repeated the mammogram, and it wasn't there. It just didn't image. And that happens in younger women with dense breast tissue, and in older women who are on hormone replacement therapy, which maintains dense breast tissue. So, I'm like Dr. Roberts. I come a little bit unglued when they say, we don't need to do mammograms every year, we don't need to do monthly exams. It confuses women, because we've preached this for how long. We finally get women on board, and then when task force comes around, it just blows it all up. So.
Oh yeah, for sure. Doctor, is there any difference between digital and traditional mammograms?
Well, the traditional we call film screen mammograms, and the digital is they're done a little bit differently as far as the technology goes. I mean, the technology for digital screening is much more advanced. It's the latest and greatest thing, basically. The sensitivity of it, there's still some controversy as far as the scientific data out there, because it's digital, it's very new. But the sensitivity is greater. We can see the skin a lot better on a digital mammogram. You can see through dense tissue a little bit better, because you're able, the degree of contrast, you're able to see through the mammogram better. So it is the preferred method.
And it's the best one, that's for sure, isn't it?
It is.
Ladies, thank you very much. And by the way, if you'd like more information, friends, you can call 778-LINK. That number is always got somebody to answer or get information to you, or you can go to their website, which is www.erlanger.org. Thank you all very much.
Thank you. Thank you.
Mr. Food's in the kitchen. Guess what? Better baked ziti.